A very good day to all of you. We are from Group 11 and continue to watch this video.
As the Director General of Health, there are so many responsibilities that need to be carried out. However, there is two most significant responsibilities, which is surveillance and business continuity. But before that, we would like to express our deep gratitude to Tan Sri Dr. Nur Hisham Abdullah as the Director General of Health. Thank you for your tremendous help in battling this pandemic. The purpose of surveillance is to aid the rapid detection of suspected cases and implement control measures to contain outbreaks. Hospital and public health departments must work together to share information when outbreaks occur, slow the spread, and investigate the source of infection through contact tracing. Business continuity is an essential domain in the societal response for COVID-19 as public health measures have adverse spillover effects on the economy. Thus, effective guidelines to restore the economy need to be implemented by balance out between business and public health.
Hi, I'm Fiza. I will explain about Prime Minister. Prime Minister is the one of the most important role in tackle the COVID-19 pandemic in Malaysia. Prime Minister responsible to first update and announce to the public about the latest issue involved COVID-19. Number 2, make quick and accurate decision to prevent the disease from spreading by Movement Control Order (MCO). Number 3, giving rules and regulation to all departments in handling COVID-19 such as National Security Council and Ministry of Health. Number 4, provide fund and support for necessities in handling COVID-19. Number 5, provide financial assistance to those affected during MCO.
As a civilian, we should follow what Prime Minister has set for the rules and regulations. First, to work from home. This enables us to keep our social distance. Also, online services or delivery is much more recommended in order to keep a social distance. If going out is necessary, always wear a mask and also sanitize your hands. Besides, scanning of the MySejahtera app will be very necessary in this pandemic.
As an academician, either in school or university, to prevent COVID-19, teachers and lecturers should ensure that students and staff practice physical distancing. Biometric marks will have been made and arrange the table at least 1 meter. Other than that, before entering school and faculties, students and staff must ensure that their temperature is checked. If above than 37.0, they are not allowed and must be quarantined. Teachers must keep educating their students by ensuring they are in hygiene and keep distance from each other to prevent COVID-19 and detect if one of them has signs of COVID-19. Lastly, to less contact face-to-face with students, teachers can do open and distance learning (ODL), which uses telecommunication to provide learning.
In this pandemic of COVID-19, one of the important roles of medical doctors is to contribute themselves in the treatment progress of COVID-19 to the COVID-19 patient in terms of their physical and mental health during this treatment progress. Also, they can contribute in the diagnosis test of COVID-19 in the medical laboratory. Next, medical doctors make efforts to upgrade or redesign the facilities in the hospital to make it more compatible to fight with COVID-19 disease. For example, the medical doctors in Hospital Sungai Buloh make efforts to renovate and redesign the hospital, allowing it to accommodate from 900 beds to 2,000 beds. Medical doctors also play an important role in minimizing the transmission of COVID-19 disease in the hospital environment from patient to patient or to other medical workers. Some of the steps that can be done is to provide sufficient hand sanitizer or mask in the hospital environment. Medical doctors should also take consideration to make a pre-operation screening and post-operation screening to the patient before going to the surgery. Last but not least, medical doctors can help the public to understand better regarding COVID-19 disease by answering their questions and doubts regarding COVID-19 disease to avoid misinformation in the public.
This is a general timeline for the problems in Malaysia. The problems including the transmission of the COVID-19 virus is very quick. The lungs may get inflamed when the person is get infected, where the lungs may be eventually become damaged, especially for elder person. People who go into overseas or come back from the overseas need quarantine time for 14 days. Also, infected person will get isolated from the social, and the major problem will be the vaccine is not available. Current cases including increases of crimes, economic drops like the GDP reduced in this year. Also, the travel and transport service become very crowded due to the MCO lockdown in Malaysia. Same goes to the groceries as well, as we can see the MCO period, the necessities become very limited. And lastly will be the education become a problem. No face-to-face teaching and learning will be a major problem for the early childhood and primary education. As a scientist, we may do more for the research to invent new things such as the virus patch to kill virus, like the function of the mosquito patch. Do more for the research in literature review of the database in the internet to ease for the studies. And do more for the clinical studies review from the other similar function virus or the vaccines result in the treatment. That's all from Group 11. Thanks for watching, and anything in detail you may see in our infographic. Bye bye!